So early on in the COVID era, in the COVID pandemic, the vaccine was almost 100% effective. So it was very good. With the changes in the virus, now with the Delta variant, and probably in the future, the variants can cause breakthrough infection. But what we notice is that patients that are vaccinated are not as sick. They don't tend to end up in the intensive care unit. Many of them are managed outside of the hospital and don't even get admitted. So vaccination is very good at limiting the illness and limiting the potential to be admitted to the hospital. So I take this back. This is the very first major issue that we have dealt with in healthcare in the era of social media. So social media, people put out statements, they put out stories, they put out anecdotes, either about the virus itself, either about the vaccine, and it goes viral. Unlike the virus we're dealing with, but the stories go viral. And many of those stories are completely wrong. And so to me, I think a lot of the misinformation has come from the fact that through Facebook, through Twitter, through different social medias, information has spread very rapidly that is not true. So there was a story recently that there was concern for impotence in a particular person from the COVID vaccine and other complications. That particular story and that famous person's friend turned out to be a fabricated story. So are there side effects from vaccines? Absolutely. Majority of the side effects from the vaccines are actually more minor than what you get with the actual infection. So when it comes to vaccination, I encourage everybody to talk to their provider, talk to their physician, to their healthcare provider to determine the role of vaccination for them. Please do not rely on social media to look at side effects and adverse events. Please talk to your experts. So the providers are variable based on how sick somebody is. So most patients are being seen by a hospital doctor. And so that is somebody who specializes in all aspects of caring for patients within the hospital. Every patient on admission is evaluated evaluated by an infectious disease provider. So we are specialists that are trained in infectious diseases, and we look at the care, we look at the chart, we advise on the therapies, we advise on any interventions that are needed. Patients that require a lot of oxygen are cared for by critical care physicians. These are lung and intensive care unit specialists, and they deal again with patients that are on higher oxygen requirements and make sure that the care is provided appropriately there. Everybody is seen by nursing staff who are providing a lot of the hour-by-hour, day-by-day care, and respiratory therapists will be seen as needed as well if you are in need of breathing treatments or other respiratory therapies to help you breathe better. So unfortunately, with viruses such as COVID, there is no miracle cure, okay? So we take advantage of what we have. For patients that are very early on in the disease, we will sometimes use an antiviral medication called remdesivir. That is meant to try to limit the amount of virus that you have, which will hopefully prevent disease progression. The majority of issues that we see with COVID are actually related to inflammation. So swelling and things like that. So steroids are the most common thing that we give majority of patients. Again, those are meant to decrease the inflammation. And then in patients who require a lot of oxygen, who might even be on a ventilator, then we have a couple other medicines that are anti-inflammatories. One is called tocilizumab, another one is called sarilumab, and then the most recent one is baricitinib. And these again are potent medications that do come with some potential side effects, and that's why we don't just give them to everybody. But in patients who require a lot of oxygen, those medicines are administered to try to decrease the inflammation within the lungs. So a couple things come into play when it comes to treatment. One is how long have you been sick? So the virus itself is usually present for the first 7 to 10 days. After that, when patients are having issues, it's because of the inflammation. So early on, we might use an antiviral medication. Later on, we tend to use more of the anti-inflammatory medications. And what really drives a lot of that is how much oxygen somebody is on. So if somebody is not requiring any supplemental oxygen, there's probably no role for COVID treatment in that person. If they are requiring supplemental oxygen, either small amounts or large amounts, we will vary our treatments based on that. But it's really based on how far into the disease and how much oxygen that one requires will determine what treatments are used. I wish we had a magic cure for COVID. I really do. So far, the literature has not shown that the vitamin C, the vitamin D, the zinc really change anything in the terms of the outcomes. A lot of the therapeutics like that, including everybody now has heard of hydroxychloroquine, when they gave it selectively to patients, they saw some benefit. But when they do in what we call in medicine randomized clinical trials, where they give it to people without blindly, so we don't necessarily know what they're getting. Some people get it, some people do not. They have found no benefit to drugs like hydroxychloroquine, to vitamin C, to zinc. And so we do not routinely administer those medicines because the literature has not shown any benefit. So ivermectin is an antiparasitic, so it's meant to treat things like scabies, okay? It's used in animals, as now everybody has heard about, but in human beings, we have used it to treat parasites for many years, okay? There was a study that suggested that ivermectin had some benefit. Again, it was what's called an observational study where they just looked at patients who got it and looked to see how they did, and it suggested some benefit. Unfortunately, that study turned out to not be real. It was plagiarized, and that study has since been taken out of the literature. It is no longer utilized. When you remove that study from the literature, now there's no studies that show benefit on ivermectin. So what we are looking at, again, is these randomized blinded studies where we give it to some people and then we don't give it to others and we see who does better. And so far, those studies have actually shown no benefit. In fact, one study actually showed patients go on the ventilator sooner when they get ivermectin. So we're following that science, and until there's evidence, if there ever is, that suggests that ivermectin actually helps, we will not be utilizing it because so far the literature has shown no benefit from that agent. So everybody responds to COVID a little differently. Again, a majority of patients who get COVID have very minor illness. Might just have a little bit of a sinus infection. I know patients who had a headache for like 12 hours, and that was all that they had with their COVID. Some people have more receptors. Some people have more health issues. So patients that are overweight, patients that are poorly controlled with their diabetes, patients who have other health issues can get just a robust immune response. And it's that inflammation to the virus that causes the issues more so than the virus itself. And right now, while we do have the risk factors that I mentioned just a couple seconds ago, there are still some people that we can't predict. We wouldn't expect them to do very poorly from the virus, and they do. And that's why, again, I really emphasize for people to please talk to their healthcare provider about vaccination. While patients that are high risk should absolutely be vaccinated, I would really encourage everybody to talk to their provider and clarify for themselves their role of vaccination so they can prevent this severe infection. So we call that proning, and with the pneumonia that you get from the COVID virus, it goes to areas where the gravity is pulling it. And so when you lay on your back all the day, then the inflammation and the inflammatory cells are in the back of your lungs. So we like to use different parts of the lung so that the lung can hopefully heal more quickly. So when you lay on your stomach, it pulls those inflammatory cells to the front of your lungs and allows the back of your lung to now start working, to start aerating and start hopefully breathing better. So we're taking advantage of gravity, and that actually has been shown in the literature to be very helpful in patients and helping them improve better. So we do encourage folks, if you're having any issues breathing, as you're laying in bed, don't always lay on your back. It might mean laying on the couch, it might just mean laying in your bed in a different way, but spend some time on your stomach and it will help your lungs work better. So that is acute respiratory distress syndrome, and that is the severe inflammation in the lungs that you get from COVID. And that is, again, that is the inflammatory response, not necessarily because the virus is still there, it's your body's dealing with the virus that has just gone overboard. And it is the biggest complication that we see from the COVID infections, and it is what absolutely leads to the prolonged breathing issues that people have. And again, one of the best ways that we can minimize that is with vaccination. That's a great question. And early on in the pandemic, the vaccine was phenomenal and you were not at risk. But now, because of changes with the virus, we are seeing more and more breakthrough. Again, the vaccine dramatically decreases your chances of getting sick, but it's not perfect. And if your loved one is in the hospital sick with COVID, they obviously have a version of the virus that is pretty aggressive. And we just want to make sure that you are not a breakthrough case. We want to keep you safe. We also need to keep our staff safe. And so we obviously want people to be masked up around our staff so that we are not catching it from other people. So it is all about keeping you safe. So we need you to reinforce what the nursing staff is working with your loved one on. So again, as we talked a couple minutes ago, laying on their stomach when they can, okay? That will help open up the lungs. There's something called an incentive spirometer, which is the tube that you breathe into to help open up those lungs. Opening up the lungs gets more lung active, gets the inflammatory cells decreasing in there and can help their oxygen levels, okay? So you want to do that. We need them to be compliant with the medications, with the therapeutics, but again, get them to lay on their stomach, use the incentive spirometer, and be as active as they can, okay? As they're able to move around the bed, try not to have them lay in bed all day. You want them up, moving around. You want them, again, even if it's when they get up to go to the bathroom, don't just walk to the bathroom and get back in bed. Walk to the bathroom, walk to the bed, walk back to the bathroom, do your business, and then do a couple laps around the room and then get back in bed. The more active they are as they feel like it, the more the lungs are used, the quicker that they can get home.